Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in healthcare IT. Today we're at the ViVE 2022 conference and we're with Mark McCurry. He's president and CEO of Verinovum. Welcome, Mark.
Thank you, John. Thank you for having me.
Yeah, so Mark, I mean, you have quite an experience in the industry. You've seen a range of ways that healthcare organizations use clinical data, claims data, and with technology. Tell us about that experience.
So the first thing I'll say is, wouldn't it be nice if you didn't have to ask me the question about data? Because then you'd know where's the best hospital, where's the best EMR, who's the best physician, what is the best place where I can find a caregiver that really has a full comprehensive view of my data. So the answer to that question, the short answer is, the healthcare marketplace is on a journey to get there. But because if you think about a hospital as being a collection of physicians providing services, it's more like a farmer's market than it is a Walmart. So you've got all these physicians producing data around providing services, and then that data gets blown in 1,000 different directions. So the facilities that I think attack this problem the best are the facilities that look at a patient holistically, that look at a patient not because of sick care, but because of health care. And they're looking at patients to provide a holistic view of their health. So they're looking at providing maybe an encounter where the patient is sick, and they're treating that patient for that illness, but they're looking at holistically, what do we need to do to use data to move that patient into a better level of care or a better level of health, which would be a better way to describe it.
Sure.
Yeah.
Well, you've talked with and worked with a lot of different organizations. So let's kind of do almost kind of case study of what you've seen. Like, how would you describe what an organization looks like that's unable to obtain and really leverage and use the, clean data?
Yeah, I think the pandemic really has exacerbated this issue because people started getting healthcare services in parking lots. People were tested all over the place, and that created a whole new challenge with healthcare data. So that provided problems for primary care physicians treating their patients. Where did you get tested? What was the result? When do we follow up? What level of care do you need because you may have COVID?
Did you hop on telehealth?
The pandemic has really brought the need for better organization and access to data. So I think the facilities that really suffered the most during the pandemic were rural healthcare providers. They didn't have the funding and the services really to treat the number of patients that were presented to them. So we live in Oklahoma, and during that period of time, the state had to bail many of the rural healthcare providers out, along with the government, so that they could actually continue to provide services. The very reason for that failure was the lack in access of data.
Interesting. So, I mean, we talk about kind of an organization that's not able to. What does it look like for an organization that is able to obtain and use and leverage clean, high-quality data?
Well, that's the promise. There are, I think, IDNs that do this relatively well. And they do it well, I think, for a lot of different reasons. The primary reason for me, this is an opinion, is because they employ their physicians. So the physicians are looking at a patient not as an encounter, but what is the journey this patient's on with a specific disease, or how do we help them get to a well state? Okay. I can give you an example as a patient. I recently I'm in an executive healthcare program with a large IDN. I spent 3 days there, and I saw probably about 12 different physicians, all of different disciplines, and all coordinating their care with me to provide the best outcome for me, not because of the specific problem I was having, but more importantly, to get me on a path for wellness. Wouldn't it be great, John, if you walked down the street and saw somebody and said, that person looks really healthy, I wonder who their doctor is? Wouldn't that be great?
Yeah, I mean, I think it would influence my decision for sure.
Yeah, of course. Yeah.
Yeah. I think that's interesting. As you look at it, and maybe as people listening and watching this, as they are there any like red flags that kind of indicate, there's probably some work to be done when it comes to their healthcare data?
Yeah, I mean, that's really a tough one because I think everybody is struggling with capturing.
Nobody has perfectly clean
Nobody
data.
has.
That's fair.
No one has perfectly clean data, and the challenge too, John, is the lack of transparency in the market itself. I mean, wouldn't it be great if you knew that this hospital was a James Beard Award-winning hospital for, if you make the restaurant analogy and their sanitation grade, what their outcomes were, what the menu looked like for services, in this case for the menu and what it would cost, then we wouldn't have to ask these questions. We'd know because it would be transparent to the entire community. Yeah. So we need to move more towards a consumerism model in healthcare, which is really hard when you're in a fee-for-service model, moving towards value-based care, but moving very slowly towards value-based care.
Yeah, it's interesting. If we knew who had clean data that could be trusted, I think we'd all make different choices, right? I mean, at the end of the day, I think that's the key is, do I as a patient and does the provider trust the data that is stored in those systems?
Boy, it's a great point. And the point is how do you find that out, right? I mean, we know certain hospitals are good at certain procedures. They're really great people that treat cancer. There are good facilities that treat neck and back injuries, but rarely do you see the published outcomes. What is the long-term prognosis for patients? A lot of hospitals are beginning to do that now in conjunction with the payer marketplace, and they're forming these, what I would call payviders, where they're actually beginning to provide a little more transparency around the outcomes for those very important procedures.
Yeah. The good news for me is that at least we now have the data. It's not stuck in a paper chart somewhere.
Yeah, we do. The other challenge with having the data is that it's scattered about in 1,000 different places. So there is a good path to try to fix that, but it has to start with the point of entry, and that means facilities really need to have strong data governance.
Yeah.
This is where you enter the data. Most physicians, because they're really busy and they're treating patients, are typically jotting down notes. Those notes about the patient end up in the EMR in the notes section, which is discrete data, which really is not digital data. That has to be transcribed or put through a natural language processor, and then it becomes actionable. So it's a very challenging problem in the industry, and one I think we're tackling.
Yeah, absolutely. Well, thanks so much for sharing all your insights and perspectives, and thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com.